Your doctor has recommended that you undergo a rubber band ligation for the treatment of internal hemorrhoids. This video will outline the important things you need to know before your procedure. This procedure is performed to treat and remove internal hemorrhoids, which are pockets of swollen blood vessels inside the rectum, which is the last part of the bowels connecting to the anus. Blood vessels in the hemorrhoids carry blood from the rectum back to the heart, and if there is a blockage of this return blood flow, these blood vessels will enlarge and swell, creating hemorrhoids. Common causes of hemorrhoids include straining on the toilet during bowel movements, pregnancy due to the extra pressure on the bowels, heavy manual labour, and sitting on hard surfaces for extended periods of time. Since internal hemorrhoids lie inside the rectum, they usually cannot be seen or felt. Bleeding is the most common symptom, and you may have noticed blood on the toilet paper or streaks of blood in your feces. Other symptoms of hemorrhoids include pain, itching, and discomfort around the anal area, especially during bowel movements. Sometimes hemorrhoids can prolapse, which is when they get bigger and bulge out of the anus. In this case, you may be able to see them as pink bumps, and bowel movements may be painful. If you take diabetes medication, insulin, blood-thinning medication, aspirin, or other non-steroidal anti-inflammatory drugs, be sure to inform your doctor, as this may need to be stopped before the procedure. Sometimes your doctor may also ask you to use an enema before the procedure, which is a medication inserted into the rectum in order to cleanse the bowel. It is important that your bladder and bowels are empty before the procedure, and it will also make you feel more comfortable during the procedure. During the procedure, a viewing instrument called an anoscope or proctoscope is first inserted into the anus in order for the hemorrhoid to be clearly seen by your doctor. The hemorrhoid is then grasped with a ligator instrument, which places a rubber band around the base of the hemorrhoid. The rubber band cuts off the blood supply to the hemorrhoid and causes it to shrink, die, and fall off in around a week. You may see the hemorrhoid and band in your stool, which is normal. A scar will form in place of the hemorrhoid, holding nearby blood vessels so they don't bulge into the anal canal. Usually 1 to 2 hemorrhoids are treated at one time, and additional areas may be treated after 4 to 6 weeks. This procedure usually takes between 15 to 30 minutes, depending on how many hemorrhoids are treated. The banding should not be painful and is performed without anaesthesia. Most patients go home on the same day as the procedure, but you will be observed for several hours afterwards. You will not be able to drive yourself home or catch public transport on your own after the procedure. Please avoid strenuous exercise such as jogging or riding a bike for the rest of the day. Afterwards, you may experience mild pain in the anal area, fullness in the lower abdomen, or a sensation of needing to open your bowels, which is usually temporary and should settle down within a few days. Most people only experience a dull ache inside the anus, which can be treated with paracetamol. If the bands are extremely painful, a local anaesthetic may be injected into the banded hemorrhoids to numb them. If you experience a lot of bleeding that does not stop, or if you develop a fever and have severe pain, consult your doctor or present to an emergency department. The benefits of undergoing this procedure include treating and removing the internal hemorrhoid. If you have symptoms such as bleeding, pain, or discomfort, these may also improve following treatment. The risks of not undergoing this procedure include not treating the internal hemorrhoid, resulting in ongoing symptoms. If bleeding from the hemorrhoid continues for an extended period of time, it may cause anemia, which is a lack of healthy red blood cells to carry oxygen around the body. Without treatment, the hemorrhoid may also increase in size and can prolapse or be pushed outside the anus, resulting in severe pain and irritation. Alternatives to rubber band ligation include coagulation therapy, which is the use of light or heat to shrink the hemorrhoid and form scar tissue, and sclerotherapy, which is where drugs are injected into the area around the hemorrhoids to shrink them. However, these methods are only suitable for small to medium-sized internal hemorrhoids and are generally less effective than rubber band ligation. Sclerotherapy injections also need to be given multiple times over several different appointments. Another alternative is hemorrhoidectomy, which is a surgical operation where the internal hemorrhoid is cut out and removed. The hemorrhoid may also be stapled to the internal lining of the anus in a surgical technique called stapled hemorrhoidectomy. These methods are generally only used if minimally invasive therapies such as rubber band ligation has been tried but failed. These methods are generally only used if minimally invasive therapies such as rubber band ligation has been tried but failed or the hemorrhoid has returned. Compared to rubber band ligation, a hemorrhoidectomy requires anesthesia and is more painful with a much longer recovery time. Any procedure has risks, which are generally rare. Most people having this procedure do not experience any complications. Uncommon risks of this procedure include bleeding from the anus, which may rarely require a blood transfusion, infection inside the anus, which may require treatment with antibiotics, slippage of bands, which may require a repeat procedure, urinary retention, which is the inability to pass urine, failure of the procedure to treat the internal hemorrhoid, or recurrence of the hemorrhoid, requiring further intervention or surgery. Rare risks of any procedure include developing a blood infection, lung infection, heart attack, stroke, or death. If complications occur, you may need to stay in hospital for a longer period of time for further investigation and treatment. Although some of these complications are serious or significant, it is important to note that the risk of these happening is low. Each doctor may have different rates of complications, which you should discuss with your doctor. Please consider any complications which may be of particular significance to you and discuss these further with your doctor. Patients at an increased risk of complications include patients who smoke, have diabetes, have severe liver disease, are obese, or take blood thinning medication. Please speak to your doctor about how you can reduce your risk. There could be out-of-pocket costs associated with your procedure, which should be discussed with your doctor. A lot of information has been presented in this video. Additional information will be provided by your doctor for you to read about this procedure. It is important to note that most complications are uncommon and it is likely you will have a successful procedure. All information presented in this video is general information. Each patient's case is different and not all information presented today may be relevant to you. Please discuss your case with your doctor, especially if you have any questions or concerns about your specific circumstances.